So we have seen the typical antipsychotic drugs. With the taking chlorpromazine as a prototype, we have discussed chlorpromazine in the details. And other drugs will also will act like a chlorpromazine. So whatever may the pharmacological actions of chlorpromazine will be that of the promazine, will be that of the same other phenothiazine derivative, like that. Adverse effect will be also the same. Only the difference will be in the pharmacokinetic properties and the severity of adverse reaction. That's it. Now in this session, the first drug is Raoulfia alkaloid. So Raoulfia alkaloids, they are obtained from Raoulfia serpentina, and these alkaloids also have antipsychotic effect. When we was discussing the alkaloids, at that time I have told you Raoulfia serpentina is also known as Pagle ki dawa. Why this is known as a Pagle ki dawa? Because these Raoulfia alkaloids, they are used in the treatment of schizophrenia, mania, and psychiatric disorders. Okay, so Raoulfia serpentina, okay, family Apocynaceae. So that alkaloids mostly they are of indole type of alkaloids, and they are used in the this anti as an antipsychotic. So what is the mechanism? These alkaloids produce depletion of endogenous catecholamines and 5-hydroxytryptamine. Endogenous catecholamines means what? So whatever the adrenaline, noradrenaline, dopamine, these are the biogenic amines, or they are also known as the endogenous catecholamines. So what does these alkaloids do? They will go in the synapse and they will deplete all the catecholamines. Means they will remove the catecholamines from the nerve endings. They will deplete. Okay, and that's why they will act as antipsychotics. They will deplete, because you know that why there is psychosis, there is a excessive dopamine in the that area, nigrostriatal area. So that's why there is a psychosis. And now this Raoulpia alkaloids deplete the catecholamines from the nerve ending. They are also not a selective in action. So ऐसा नहीं कि सिर्फ वो डोपामाइन को ही डिप्लीट करेगा. They used to deplete all the catecholamines like noradrenaline, adrenaline, acetylcholine, all that, 5-hydroxytryptamine, serotonin, and all that. So they are also antihypertensive because of the depletion of noradrenaline. They will also act as antihypertensive. Okay, so they are used in the psychosis also, and they are antihypertensive also. That's why Raoulpia is known as a Pagli ki dawa. So Raoulpia is also antihypertensive. So remember, so they produce depletion of endogenous catecholamines, okay, and 5-hydroxytryptamine. And catecholamines means your noradrenaline, dopamine, then 5-hydroxytryptamine, etc. Okay, so they will have a similar action to phenothiazines on CNS. Major difference is that phenothiazines will have different actions. Like phenothiazines also histamine receptor. Okay, so histamine receptor blocker. But these alkaloids will not have antihistaminic action. These alkaloids will not have cholinergic blocking or anticholinergic action. But your phenothiazines will have phenothiazines, particularly chlorpromazine. It is known as a large actyl. Why it is known as a large actyl? Because it has a different action. It has a different pharmacological action. It has different pharmacological uses also. It has a wide variety of actions. It is antipsychotic. It is an antihistaminic. It is an anti-muscarinic. That chlorpromazine. Then chlorpromazine is also anti-emetic. So that's why that chlorpromazine is known as a large actyl. But these Raoulpia alkaloids will not have such kind of action. They are not a they are not having wide variety of action. They will only have this antipsychotic and antihypertensive action. That's why. That is the difference. That chlorpromazine and Raoulpia alkaloid. So Raoulpia alkaloid like reserpine, serpentine, etc., etc. So that they will not have this antihistaminic action, anti-muscarinic action. So remember, इसके ऊपर भी एक बार क्वेश्चन आ चुका है. So Raoulpia alkaloids, they will cause depletion of biogenic amines. Raoulpia alkaloids will cause depletion of endogenous amines. They are similar like phenothiazine in case of CNS action, but they will not have antihistaminic action and anticholinergic action. They will also produce similar calming effect. They will also reduce the excitement in case of schizophrenia and manic patient. They will also produce similar calming effect, but extrapyramidal effect like phenothiazine. So they will also have similar pharmacological spectrum of action like your phenothiazine, but they will not have cholinergic blocking and histaminic blocking. Okay. So they will also produce the similar kind of calming effect in case of schizophrenic patient, and they will also produce extrapyramidal symptoms like phenothiazine. Means they can produce Parkinsonism. Okay, extrapyramidal symptom is symptoms of Parkinsonism. That's why this Raul PI is also under the typical antipsychotic because it will produce this extrapyramidal symptoms. Again, this is also antihypertensive because of the depletion of your noradrenaline. It will act as an antihypertensive because most of hypertension क्यों होता है because of that adrenaline or noradrenaline. They will act on either alpha receptor peripherally. They will increase the peripheral resistance and they will increase the peripheral resistance. Okay, and by acting on a beta 1 receptor, they will increase the heart rate and force of contraction. Both action leads to increase in the blood pressure. That's why this depletion of noradrenaline causes antihypertensive effect. So Raul will deplete the catecholamines. It will act as an antihypertensive. It will act as an antipsychotic, but it will not produce any antihistaminic action. It will not produce any anticholinergic action. It causes mental depression. Adverse effect of this Raul alkaloids, if they are used in the treatment of schizophrenia or manic patient, they can cause mental depression and they can precipitate the suicidal tendency. Patient taking this Raul alkaloid may become suicidal in intent. So suicidal tendency बढ़ जाएगा उसका. And it is no more used as an antipsychotic drug because a lot of drugs are available. Just remember the mechanism of this Raul alkaloid. So depletion of endogenous catecholamines. Now haloperidol, another drug, antipsychotic drug. That is a typical one. Okay, this is also typical one. Haloperidol. It is a potent drug. Potent means what? A very small amount or very small dose or very small quantity of drug is required to produce a pharmacological effect. So it is a potent drug. It is a potent antipsychotic drug. So only 1 to 2 milligram dose of haloperidol is required to sedate the or to calm the aggressive patient in the schizophrenia. Okay. So other pharmacological or clinical effect is like phenothiazines, whatever we have seen, like action of phenothiazine, chlorpromazine on CNS, ANS, GIT, etc. So other pharmacological or clinical actions are like phenothiazine. It is a least prominent sedative and having least autonomic effect. जैसे क्लोरप्रोमाजिन में क्या होता है कि एटोनॉमिक इफेक्ट भी मिलता है आपको. It is a least sedative and least having least autonomic effect. It is highly effective in case of agitated patient. जो पेशेंट एग्रेसिव है, जो मैनियक पेशेंट या फिर सिजोफ्रेनिक पेशेंट है जिसमें एग्रेशन ज़्यादा है. Okay, so it is highly effective in agitated and manic patient. Now another derivative of this haloperidol, trifluperidol. Trifluperidol is a derivative. Then again another derivative is droperidol. Droperidol. Okay, trifluperidol and trifluperidol and droperidol. These are used along with the combination with opioid analgesic. So particularly this droperidol and fentanyl. Okay, droperidol and fentanyl. ये जो है this fentanyl and droperidol, that is a very much famous combination used in the neuroleptic analgesia. So इसके ऊपर भी क्वेश्चन आ चुकी है ऑलरेडी. इसका concentration भी आ चुका है. We have already seen this question in the when we was discussing the opioid analgesic. So droperidol plus fentanyl, they are combined together to get a neuroleptic analgesia. Adequate loss of pain plus fear. Haloperidol shows maximum extrapyramidal symptoms. Whatever underline, that is very important. So it will show highest maximum or highest extrapyramidal symptom as an adverse effect. तो इसके ऊपर भी क्वेश्चन आ चुका है. One of the following drug will be highest in case of producing the Parkinson symptoms, or one of the following drug will be will produce highest extrapyramidal symptoms. That is nothing but the haloperidol. And remember, along with that, haloperidol is the highest EPS producing drug, whereas this thioridazine is the least producing the extrapyramidal symptom. तो यहाँ पे याद रखो कि haloperidol जो है आपका, that will produce highest extrapyramidal symptoms. A typical antipsychotic having highest extrapyramidal adverse effect, that is nothing but your haloperidol. Typical antipsychotic drug having least extrapyramidal symptoms, or drug which is having least extrapyramidal symptom as adverse effect, that is nothing but the thioridazine. Underline this. So Haloperidol जो है that will produce highest extrapyramidal symptoms, ये याद रखो. And thyroidazine will produce slow or least extrapyramidal symptom. Fenfluridol is also again a drug. Fenfluridol, that is also a derivative of this haloperidol, that is a longer acting. ठीक है, जैसे haloperidol हो गया, उसके भाई बहन कौन है, उसका उसके छोटा भाई है ट्राइफ्लूपेरिडोल, और उसका और एक छोटा भाई है ड्रोपेरिडोल, और एक अभी पैदा हुआ है कौन है, फेनफ्लुरिडोल. सो ये सभी उसके भाई है. ठीक है, ट्राइफ्लूपेरिडोल एंड ड्रोपेरिडोल, इट इज यूज्ड along with the opioid analgesic known as fentanyl to produce neuroleptic analgesia. ये याद रखो. And this haloperidol will produce highest extrapyramidal symptom. Thyroidazine will produce least extrapyramidal symptoms. ये याद रखो. Another drug is known as a pimozide and sulfide, levosulfide और pimozide. Sulfide होता है कि levosulfide भी होता है, तो levo derivative. Pimozide and levosulfide. Sulfide, they are more specific antagonist. They are more specific antagonist to the post-synaptic D2 receptor. That is the only difference. Rest of the things will be similar to like that of phenothiazine. We have seen the group first, group 3, group 2, group 3 drugs. In the group 1 drugs which comes under group 1, typical antipsychotic drug. जो typical antipsychotic drugs होते हैं, those drugs which comes under group 1, they will produce highest sedation. They will also have anti-muscarinic effect. They will also have extrapyramidal. Group second जो जिसमें group second में जो आता है, वो उनको moderate sedation आता है as adverse effect. उनको ये भी है, क्या बोलते हैं, anti-muscarinic activity भी, and they will have least extrapyramidal effect. This is thyroidazine. Then in group 3, those drugs which will have least sedation, least anti-muscarinic effect, but they will produce highest extrapyramidal symptom like haloperidol. ये thyroidazine. Now atypical antipsychotic drugs. So we have completed typical antipsychotic drugs. So typical antipsychotic drugs means they will have extrapyramidal symptoms. They will produce Parkinsonism in the patient. तो ये होता है कि जो typical होता है वो फिर extrapyramidal symptom दिखाएगा, और उसको बोलते हैं conventional antipsychotics. Okay, or first generation antipsychotics. Now atypical antipsychotics means what? They will not have extrapyramidal symptoms or extrapyramidal adverse effect. They will not produce Parkinsonism in the patient. So that's why they are gaining more popularity nowadays. Atypical antipsychotics. So they are also known as the second generation antipsychotics. Atypical second generation, typical first generation. Okay. Classical antipsychotics or first generation antipsychotics, they will have narrow therapeutic index. जो पहले है टिपिकल एंटीसाइकोटिक जो है, जैसे क्लोरोफॉर्मेजोन, haloperidol वगैरह, clozapine etc. So those are having narrow therapeutic index. But this atypical antipsychotic, they will have wide therapeutic index. Classical antipsychotic means first generation or typical antipsychotic. They will have narrow therapeutic index and they will cause extrapyramidal symptom. But atypical antipsychotic drugs, they will provide wide safety of margin. Wide safety of margin means they will have wide therapeutic index and they will have lower extrapyramidal symptom, tardive dyskinesia as an adverse effect. Now again, except risperidone. Risperidone जो है, it is again a atypical antipsychotic drug. Risperidone जो है, it is an example of atypical antipsychotic drug. Except risperidone, atypical antipsychotic drugs will not have hyperprolactinemia as an adverse effect. जैसे अपन ने देखा था टिपिकल एंटीसाइकोटिक ड्रग में उनको एक्स्ट्रापिरामिडल एडवर्स इफेक्ट भी आता है, हाइपरप्रोलैक्टिमिया भी करेंगे इसमें लेडीज में, बिकॉज ऑफ द ब्लॉकिंग ऑफ द डोपामाइन रिसेप्टर इन द hypothalamus area. So but atypical or second generation antipsychotic drugs, they will not produce hyperprolactinemia, but there is one exception known as risperidone. इसके ऊपर भी क्वेश्चन आता है. Risperidone is a second generation antipsychotic drug. It is an atypical antipsychotic drug but produces hyperprolactinemia but does not produce extrapyramidal symptoms. We'll see pharmacology of atypical antipsychotic drugs. The first one is risperidone. In case of atypical antipsychotic drug, first drug is your risperidone. Okay. So again, it is a D2 receptor, 5-HT receptor, alpha adrenergic receptor, and histaminergic receptor blocking agent. Okay. So it blocks the receptors like dopamine receptor, 5-HT means serotonin receptor, and alpha adrenergic receptor, histaminergic receptor मतलब हिस्टामाइन को, तो डोपामाइन रिसेप्टर को ब्लॉक करेगा, सेरोटोनिन को ब्लॉक करेगा, अल्फा ब्लॉकर भी है, हिस्टामाइन रिसेप्टर ब्लॉकर भी है. It can cause dyskinesia and hyperprolactinemia. It is the second generation drug. Okay, so second generation drug will not have hyperprolactinemia as adverse effect except this risperidone. Other adverse reaction includes postural hypotension, that is because of the alpha blocking. Okay? Postural hypotension मतलब क्या है? जैसे मैं खड़ा हो गया तो मेरा ब्लड प्रेशर नॉर्मल है, जैसे मैं लेट गया तो मेरा ब्लड प्रेशर क्या होगा, बढ़ जाएगा, सॉरी कम हो जाएगा. दैट इज नोन एज पोस्चरल हाइपोटेंशन. सो पोस्चर चेंज हो गया आपका तो आपको हाइपोटेंशन हो गया, उसको बोलते हैं पोस्चरल हाइपोटेंशन, एंड दैट इज बिकॉज ऑफ दैट अल्फा एड्रेनर्जिक ब्लॉकिंग एक्टिविटी. सो दोज टिपिकल एंटीसाइकोटिक ड्रग, दोज और टिपिकल और एटिपिकल, those drugs which are having alpha 1 blocking activity, antipsychotic drug having alpha 1 blocking activity, they will have adverse effect of postural hypotension. So this risperidone will block all that 5-HT dopamine receptor, histaminic receptor, alpha adrenergic receptor. So it can cause tardive dyskinesia, hyperprolactinemia, other adverse reactions like postural hypotension, insomnia and constipation. Insomnia मतलब क्या? Insomnia मतलब lack of sleep. So it is effective as effective as haloperidol, but it has no extrapyramidal symptom. So haloperidol की जैसे ही effective है in case of pharmacological action, in case of schizophrenia, but it will have lower extrapyramidal effect. It is used to treat tantrums, aggressions. ठीक है? In case of schizophrenia, it is used to treat tantrum, aggressions, self injurious behavior. मतलब self injurious behavior मतलब ये देखो, जो सिजोफ्रेनिक पेशेंट होता है वो खुद को ही मार लेगा, मतलब कुछ अगर कहीं पे सर पटक लेगा या फिर कुछ भी कर लेगा, खुद को इंजरी कर लेगा. सेल्फ इंजरीज बिहेवियर विथ ऑटिस्टिक डिसऑर्डर, जिसको ऑटिज्म वगैरह ऑटिस्टिक डिसऑर्डर है उसमें भी यूज करेंगे. देन पैलिपेरिडोन इज एक्टिव मेटाबोलाइट ऑफ रेस्पेरिडोन, ये भी याद रखो. अनदर ड्रग इज देयर नोन एज पैलिपेरिडोन इज अ एक्टिव मेटाबोलाइट ऑफ योर रेस्पेरिडोन. नेक्स्ट एटिपिकल एंटीसाइकोटिक ड्रग क्लोज़ापिन, इसके ऊपर क्वेश्चन आ चुका है. वन ऑफ द फॉलोइंग ड्रग इज अ सेकंड जनरेशन एंटीसाइकोटिक ड्रग और वन ऑफ द फॉलोइंग ड्रग इज अ एटिपिकल एंटीसाइकोटिक ड्रग. तो क्लोज़ापिन इज एटिपिकल, रिमेंबर, कंफ्यूज नहीं होने का. इट्स एडवर्स इफेक्ट, इट कैन कॉज ए ग्रेनुलोसाइटोसिस. ठीक है, ए ग्रेनुलोसाइटोसिस क्या है, इसका एडवर्स इफेक्ट है. इट इज यूज्ड फॉर द सिजोफ्रेनिया रेजिस्टेंट टू स्टैंडर्ड थेरेपी. मतलब जो नॉर्मली सिजोफ्रेनिया ड्रग यूज करते हैं, अगर इफ पेशेंट इज नॉट रिस्पॉन्डिंग टू ए normal therapy or standard therapy of antipsychotic drug, then you can replace standard therapy with clozapine. So clozapine is used for the schizophrenia resistant to standard therapy. Now, it can modulate the effect in the limbic system, dopaminergic system, and to some extent 5-HT. Yes, it will block the dopaminergic receptor, block the serotonin receptor, and it is having also anticholinergic. It is also having anti-muscarinic. It can cause less extrapyramidal symptoms. मतलब ये सेकंड जनरेशन है तो कम करेगा. सेकंड जनरेशन जो ड्रग्स होते हैं एंटी साइकोटिक्स, दे विल नॉट हैव अ extrapyramidal symptom as adverse effect, or they will have a less extrapyramidal symptom adverse effect. That's why these second generation drugs they are mostly used. Now adverse reactions of this clozapine क्या है इसका? nausea, vomiting, sedation, orthostatic hypotension, and tachycardia, confusion and delirium. So this is a clozapine. इसका सिर्फ याद रखो कि मैकेनिज्म और इसका एक स्पेसिफिक एडवर्स इफेक्ट है क्लोज़ापिन का, दैट इज ए ग्रेनुलोसाइटोसिस. ग्रेनुलोसाइट जो है डब्ल्यूबीसी में, उसका क्या होगा, लेवल कम हो जाएगा ब्लड में, ए ग्रेनुलोसाइटोसिस. ओके, क्लोज़ापिन सेकंड जनरेशन एंटीसाइकोटिक ड्रग. नेक्स्ट वन इज ओलेनजेपिन. क्लोज़ापिन का ही डेरिवेटिव है, उसका ही सौतेला भाई है ओलेनजेपिन. ठीक है, तो it is a dibenzodiazepine similar to clozapine. Dibenzodiazepine derivative similar to clozapine, but it has a greater serotonin 5-HT2 receptor and D2 receptor blocking activity. It also having lower extrapyramidal symptom. Second generation है तो extrapyramidal symptom क्या होगा, कम ही होगा. Dopamine receptor blocker and 5-HT receptor blocker. It will produce higher risk of stroke and death in the elderly patient. जो जेरियाट्रिक पेशेंट होते हैं, जो एजेड पेशेंट होते हैं, उनमें ये ओलेंजेपिन क्या करेगा, इट विल प्रोड्यूस रिस्क ऑफ स्ट्रोक एंड डेथ। जैसे स्ट्रोक आता है तो ओलेंजेपिन लेने के बाद में उसका रिस्क ज़्यादा बढ़ता है स्ट्रोक आने का। देन इट इज़ स्पेसिफिकली यूज्ड फॉर टूरेट सिंड्रोम। इट इज़ स्पेसिफिकली यूज्ड फॉर टूरेट सिंड्रोम। टूरेट सिंड्रोम क्या होता है? टूरेट सिंड्रोम मतलब हिचकी। आपने एक मूवी आया था रिसेंटली लास्ट ईयर रानी मुखर्जी का, उसका नाम था हिचकी। तो हिचकी हिचकी मतलब जो भी जैसे भी कोई स्ट्रेस आता है या फिर जैसे भी कोई टेंस एनवायरनमेंट होता है तो उसमें जिसको टूरेट सिंड्रोम है उसको क्या होता है कि हिचकी आना चालू होता है, कंटिन्यूसली उसको हिचकी आता है। ठीक है, तो आपने देखा होगा वो मूवी हिचकी। तो इन दैट मूवी दैट एक्ट्रेस रानी मुखर्जी सफरिंग फ्रॉम टूरेट सिंड्रोम। So olanzapine is used for specially for Tourette syndrome. Now ziprasidone, another drug, ziprasidone and aripiprazole are second generation antipsychotic. Other second generation. तो आपने देखा है रेस्पिरिडोन, क्लोज़ापिन, ओलेंजापिन, ziprasidone, aripiprazole. They are second generation antipsychotic drugs. Now we'll see the next. Next one is the selected antipsychotic drugs and their adverse effect. ठीक है, तो एंटीसाइकोटिक ड्रग्स फर्स्ट जनरेशन कौन है, सेकंड जनरेशन कौन है, उसका मैकेनिज्म याद रखो, उसका एडवर्स इफेक्ट याद रखो, बाकी चीजें आपको कोई पूछेगा नहीं। तो सिलेक्टेड एंटीसाइकोटिक ड्रग्स एंड देयर एडवर्स इफेक्ट और देयर साइड इफेक्ट, ये सब में आएगा। थायोरिडाजिन का एक स्पेसिफिक एडवर्स इफेक्ट है आपको, रेटिनल डिजनरेशन। सो थायोरिडाजिन थायराइडिज्म विल कॉज रेटिनल डीजनरेशन। सो आपको रेटिना जो है आपका रेटिना वो खराब करेगा, रेटिनल पिगमेंटेशन, रेटिनल डीजनरेशन। देन ड्राई माउथ बिकॉज ऑफ द मस्कर्निक ब्लॉकिंग, ब्लर विजन, कॉन्स्टिपेशन एंड यूरिनरी रिटेंशन। यूरिनरी रिटेंशन, ड्राई माउथ, कॉन्स्टिपेशन इज बिकॉज ऑफ द मस्कर्निक ब्लॉकिंग एक्शन। नेक्स्ट वन इज क्लोज़ापिन, ए ग्रेनुलोसाइटोसिस। क्लोज़ापिन का क्या है एडवर्स इफेक्ट, ए ग्रेनुलोसाइटोसिस। So remember thyroidazine will cause your retinal degeneration, then dry mouth, blurring of vision, constipation and urinary retention. That is because of the muscarinic blocking. Clozapine will have specific adverse effect of agranulocytosis, decrease in the granulocyte count in the blood. Then chlorpromazine will have specific adverse effect of cholestatic jaundice. तो बाइल है, बाइल का जो फ्लो है वो क्या करेगा, बंद कर देगा। So that's why if bile flow is obstructed, then your blood level of your bile acids will raise, okay? And that is will called that could cause jaundice, cholestatic jaundice. Now types of extrapyramidal symptom, we have seen a lot of times extrapyramidal side effect, extrapyramidal symptoms, but what is exactly extrapyramidal symptoms? Okay, so types of extrapyramidal symptoms, okay, इसमें symptoms क्या क्या आते हैं, extrapyramidal symptoms मतलब क्या? First one is acute muscular dystonia. Acute muscular dystonia. So your muscle has a specific normal tone. आपके मसल में एक पर्टिकुलर टोन होता है, आपका मसल पूरा रिलैक्स नहीं होता, इसमें कुछ टोन होता है, कॉन्ट्रैक्शन, होल्डिंग, व्हाट इज नोन एज अ नॉर्मल टोन। सो acute muscular dystonia मीन्स आपका जो टोन है वो लॉस हो जाएगा। So your tone will not be normal. That is known as a dystonia. Okay, normal tone, dystonia. Dystonia means abnormal tone. Atonia means loss of tone. Acute muscular dystonia is also one of the extrapyramidal symptom and it is the earliest appearing symptoms. So ये typical antipsychotic drugs का जो होता है, so इसमें ये earliest appearing symptoms है, acute muscular dystonia. Parkinsonism that occurs in the after 1-4 week of therapy. So if you continue typical antipsychotic drug for this 1 or 4 weeks, 1 to 4 weeks, then you will get Parkinsonism. Then akathisia means again, akathisia means numbness. Akathisia means numbness. Okay, so आपके पैर वगैरह सुन पड़ जाएंगे. Akathisia means numbness. So most common extrapyramidal symptom. So it is the most common extrapyramidal symptoms. Akathisia. Remember इसके ऊपर क्वेश्चन आ चुका है. Cigarette smoking is associated with the risk. So cigarette smoking is also associated with the risk of getting akathisia. Akathisia means numbness. Then propranolol. It is a beta blocker. It is a non-selective beta blocker. It is a preferred drug for this treatment of akathisia. Then malignant neuroleptic syndrome. We have seen that Malignant neuroleptic syndrome is an adverse effect of your chlorpromazine or typical antipsychotic drug. There is a hyperthermia, then extreme generalized muscular rigidity, then autonomic instability. Remember the drug of choice in malignant neuroleptic syndrome, इसके ऊपर भी क्वेश्चन आ चुका है. That is nothing but the dantrolene. Dantrolene is the drug of choice in the malignant neuroleptic syndrome. So next symptom of your extrapyramidal is tardive tardive dyskinesia. Tardive dyskinesia. So tardive dyskinesia means what? Purposeless involuntary movement like chewing, popping, or popping of chips, uh, popping of cheeks. Let's say I will explain this. Purposeless involuntary movement like chewing or popping of cheeks. So you might have seen in your home if any geriatric patient और आपके दादाजी होंगे या फिर दादी होंगी या फिर हुआ जो परदादी होंगी परदादा होंगे जसे आजी आजोबा पणजोबा वगैरे असतात त्यांच्याकडे कसं असतं त्यांचं हे म्हणजे त्यांच्यामध्ये एक त्यांच्या चेहऱ्याकडे बघा तुम्ही पर्पजलेस इनव्हॉल्टरी मुवमेंट असतात ते काही खात नसतात पण ते तरी पण खाण्याची ऍक्टिंग करतात 24 आवर्स काहीतरी खातात चिव करतात नंतर पपिंग म्हणजे असं गाल फुगवणे जे दिसतात तुम्हाला म्हणजे आपने देखा होगा जो ग्रैंड मदर ग्रैंड फादर या फिर उनका ग्रेट ग्रैंड मदर ग्रेट ग्रैंड फादर they used to have one habit chewing something. They will not chew but they will act like a chewing. They will not have anything in the mouth but they will have popping. So that is known as a tardive dyskinesia. That is also one of the symptom of your extrapyramidal or that is a Parkinson syndrome. We'll see the next. So first is a chlorpromazine. It is a drug group chlorpromazine. In that you have different derivative like promazine, prochlorperazine, etc. etc. We have seen that chlorpromazine. So they will have extrapyramidal symptoms, moderate extrapyramidal symptoms. They will also block the muscarinic receptor. They will have highest capacity to block alpha receptor. They will also produce the sedation. So chlorpromazine is a prototype having low potency. Cellular dysfunction as an adverse effect. Thyroidazine also produce extrapyramidal effect but less least okay least मतलब ये सिर्फ वन देखा है so it will produce least extrapyramidal adverse effect from the group first that is a typical okay also has capacity to block the muscarinic receptor and your alpha blocker also then it will also produce sedation. It has a low potency phenothiazine. It is a low potency phenothiazine. Adverse reaction क्या है retinal deposit, retinopathy or retinal degradation. We have seen the cardiotoxicity is also there. Toxicity point means it can produce arrhythmia. Then fluphenazine. So having extrapyramidal adverse effect, weak muscular blocking activity, strong alpha blocking activity, and sedation. High potency phenothiazine. कौन है? Fluphenazine. The next one is a haloperidol. So it also has a highest extrapyramidal symptoms. ठीक है यहाँ पे drug is having highest adverse effect of extrapyramidal symptoms. Then again it can block the muscarinic receptor in a small amount. It will also have less sedation. High potency butyrophenone. It is a high potency butyrophenone. Then clozapine. It will not have any extrapyramidal symptom. It can block the muscarinic receptor in a moderate amount. Then it also block the alpha blocker blocking activity. It will have sedation, least sedation. So it is a specific D2 receptor blocker, D2C subtype, D2 receptor C subtype. 5-HT is a blocker. No extrapyramidal symptom. Tardive dyskinesia, agranulocytosis is the adverse effect. Weight gain is the adverse effect. Seen this. Next one is olanzapine. So it will also drug which is not having any extrapyramidal adverse effect. Block the muscarinic receptor in the least, and it is having moderate alpha blocking activity, and again it will having least sedation property. So it is again 5 receptor serotonin receptor blocker. It will improve the negative symptom. There are two kind of symptoms in the schizophrenia: positive symptoms and negative symptoms. So illusion and hallucination. If patient is having illusion or hallucination, that is known as a positive symptoms, and if patient is having delusions, that is known as a negative symptoms. So olanzapine is the only drug which can improve the negative symptoms in the schizophrenic patient. ये भी याद रखो थोड़ा सा. Olanzapine is the only drug which can improve the negative symptoms. Then risperidone, this clozapine, olanzapine, risperidone. These are the second generation drug. That's why they will not have any this extracerebral effect. Okay. Risperidone has a least extracerebral effect, but then it will not having any muscarinic blocking. Moderately block the alpha receptor. Moderately produce region. It is a serotonin receptor blocker and improves negative symptoms, but it can produce possible tardive dyskinesia. Now, what are the uses of antipsychotic drugs? Okay. So, antipsychotic drugs are used in the treatment of schizophrenia. Okay. They are also used in the treatment of psychosis, okay, or psychosis associated with the Alzheimer's disease. ठीक है, जिसको अल्जाइमर्स है उसमें भी साइकोसिस होता है. अल्जाइमर्स मतलब क्या? अल्जाइमर्स मतलब लैक ऑफ एसिटिल कोलिन इन द ब्रेन, लैक ऑफ कोलिनर्जिक न्यूरॉन्स इन द ब्रेन और डीजनरेशन ऑफ कोलिनर्जिक न्यूरॉन्स. आपने एक मूवी देखा होगा, उरी द सर्जिकल स्ट्राइक. इन दैट मूवी द एक्टर विकी कौशल and his mom is suffering from Alzheimer's disease. Okay? So he used to forget everything. That is Alzheimer's, lack of memory. Then bipolar disorder. Okay? Bipolar disorder. So this mania is divided into two types, unipolar and bipolar. So in case of bipolar disorder, lithium carbonate is used. In case of in the treatment of Tourette syndrome, so these antipsychotic drugs can be used like pimozide and clozapine and all that. So pimozide is a drug of choice in case of Tourette syndrome. Pimozide is a drug of choice in case of Tourette syndrome. Then they are also used in the pre-operative sedation, like promethazine. Sorry, not prom. Then they are also used to control the vomiting due to radiation-induced emesis. Okay, for example, prochlorperazine. So रेडिएशन इंड्यूस्ड इमेसिस, जैसे किसी को अगर कैंसर का रेडिएशन थेरेपी दिया है उसमें क्या होता है? वोमिटिंग होता है. सो टू प्रिवेंट दैट क्लोरप्रोमेजिन इज गिवन. Then they are also used in the neuroleptic analgesia. So famous combination is droperidol fentanyl. ये फेमस कॉम्बिनेशन है. इसके ऊपर क्वेश्चन आ चुका है, मैंने बोला है. ड्रोपेरिडोल फेंटेनिल, इसका कॉन्सेंट्रेशन भी डिस्कस किया था अपन ने when we was discussing the opioid analysis. Next one is a depression. Okay, so we have seen the antipsychotic drugs. Now antidepressant drugs. So you should know what is meant by depression. What do you mean by depression? So depression means what? So if anybody is suffering from depression, what will be the symptoms of that patient? Depression means what? Lack of interest. Lack of interest. The patient is not able to enjoy. The patient is not able to enjoy. The patient remain detached. The patient will not enjoy. Will not feel pleasurable. Suppose that if India win, you are sitting in front of TV and there is a match, India-Pakistan match, and India wins. So you all are enjoying, but depressed patient will not enjoy because he is not feeling any kind of pleasure. So it is an affective disorder. Depression is an affective disorder. The patient will lack the affection. Okay, so patient will be isolate himself. Okay, patient will isolate himself. He will not enjoy anything. Then his thoughts will be different. Thoughts process will be different. Okay, then he will have suicidal tendencies. तो suicide करने का भी try करेगा. That is nothing but the depression. Patient will be depressed. So depression is because of the depletion of biogenic amines from the brain. So depletion of biogenic amines, depletion of catecholamines from the brain. That is related with the depression. So it is an affective disorder of brain. What is depression? It is an affective disorder of brain. If you want to read more about the depression, what is depression and how it appears, what are the symptoms of patient, I have told you in the very short way. So that depression means patient will isolate himself. He will not take interest. He will have its own environment. He will not enjoy anything. Okay, so it is an affective disorder. It will affect the perception. Okay, so it is an affective disorder of brain and it is associated with the depletion of catecholamines or depletion of biogenic amines from the brain. Okay, depletion of noradrenaline, serotonin, these kind of biogenic hormones. So neurotransmitters will be depleted. That is a depression. So those drugs which are known as a antidepressant. Now antidepressants, these are the drugs which are known as a psychoanalytic drug. Psychoanalytic drug are also called as a mood elevator. अगर आप डिप्रेशन में हो तो आपका मूड एलिवेट करना पड़ेगा ना. सो उनका मूड पहले ही डाउन होता है. मूड स्विंग इज वन ऑफ द सिम्टम ऑफ योर डिप्रेशन. तो डिप्रेशन में क्या क्या सिम्टम पाएंगे? मूड स्विंग होगा, एग्रेशन होगा, कि कभी कभी एग्रेशन होगा, उसको सुसाइड करने का सुसाइडल टेंडेंसीज होगा, उसमें सुसाइड करने का ट्राई करेगा. ठीक है. उसके बाद में क्या, उसको एंजॉयमेंट नहीं रहेगा, ही विल नॉट एंजॉय एनीथिंग. दैट इज अ डिप्रेशन. So antidepressants are the drug that will they are used to treat the depression. Okay, they will improve the mood of patient. That's why they are known as a mood elevator or psychoanalytic antidepressants. Okay, so you might remember the case of Sushant Singh Rajput. I don't know the exact cause of death, but as per the rumors, as per the news, he was suffering from depression. Now, antidepressant drug, they act by increasing the availability of monoamines in the brain. They will increase the availability of these, okay, let's say adrenaline, noradrenaline, serotonin, okay, etc. So they will dopamine. They will increase the availability of brain by availability of monoamines in the brain. So dopamine हो गया, serotonin हो गया, bioadrenal that is serotonin, and noradrenaline. So they act by increasing the bioavailability of monoamines. Drugs used in the depression. Antidepressant. So antidepressant mostly they will increase the biogenic amines. They will increase the catecholamines in the brain. Okay. Now there are different way how you can increase the catecholamines in the brain. कैसे करेंगे आप? उसका सिंथेसिस बढ़ा दो या फिर उसका मेटाबॉलिज्म कम कर दो. ठीक है. सिंथेसिस बढ़ाओ या फिर मेटाबॉलिज्म कम करो. Now classification of antipsychotic, classification of antidepressant. So before understanding the classification, you should know what are the targets. Okay. So classification of antidepressants. So those drugs which are used to prevent the depression, those are known as antidepressants. So they are classified in different way. Different books have one different classification. I am taking at least 3 classifications. So first one is a tricyclic antidepressants. Tricyclic antidepressants. So these drugs will have a tricyclic structure or polycyclic. They are also known as a polycyclic. Tricyclic antidepressant or tricyclic and polycyclic. Okay. Example like this: imipramine, amitriptyline, nortriptyline, desipramine, trimipramine, maprotilene, doxepin, okay, amoxapine, then clomipramine, dothepine, and protriptyline. These are the examples of tricyclic antidepressants. Now another class known as a selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitor. SSRI. As the name indicates, selective serotonin. Serotonin means 5-hydroxydiptamine. So they reuptake inhibitor. So normally क्या होता है कि जैसे साइनेप्स होता है या फिर नर्व एंडिंग होती है, वहाँ पे क्या होगा कि जो न्यूरोट्रांसमीटर है जैसे एड्रेनलिन, नॉरएड्रेनलिन या फिर डोपामाइन, so that will be synthesized, that will be stored in the synaptic vesicle. We have seen that, and they will be released upon stimulus. Now after release, some part of that neurotransmitter will be taken up in the neuron, known as a uptake or reuptake. Okay, so these will prevent the reuptake of serotonin or 5-hydroxydiptamine. So that's why they are known as selective serotonin reuptake. They are selective in nature. That means they will only prevent the reuptake of serotonin. Example याद रखो आपका ज़्यादा important है examples. So fluoxetine, zetine, then paroxetine, fluoxamine, trazodone, sertraline, nepazodone, then valnafrexine and citalopram. Citalopram के बारे में क्वेश्चन आ चुका है. Citalopram is a selective serotonin reuptake inhibitor. Fluoxetine is a selective serotonin reuptake inhibitor. So zetins जो है वो zetins ZETIN zetins जो है वो selective serotonin reuptake inhibitor होते हैं. लेकिन there is one exception. We'll see it later. So remember, fluoxetine, paroxetine, fluoxamine, trazodone, sertraline, nepazodone, venlafaxine, and citalopram. These are the selective serotonin reuptake inhibitors. Then MAO inhibitors, mono amino oxidase inhibitor. So MAO क्या है? Mono amino oxidase. MAO मतलब mono amino oxidase. So it is the enzyme responsible for the metabolism of your biogenic amines और catecholamines. जो catecholamines होता है जैसे नॉरएड्रेनालिन, डोपामाइन, आपका सेरोटोनिन, तो उसका मेटाबॉलिज्म करने वाला एंजाइम कौन सा है? माओ। और दूसरा भी एक होता है कॉम्ट, COMT, उसका रोल अलग है, अपन बाद में देखेंगे। कॉम्ट होता है और एक माओ होता है, ठीक है। सो माओ दैट मेटाबोलाइज द मोनोअमाइन्स और बायोजेनिक अमाइन्स, सो मोनोअमाइन ऑक्सीडेज इनहिबिटर, फॉर एग्जांपल दिस phenelzine isocarboxamide tranylcypromine. This is a MAO inhibitor. Now this was a classification. Again we'll see the classification given in another book. The classification given in my own, in मेरे book में या मैंने ऐसा, so we'll see it. So classification of antidepressants. Okay. So first class will be MAO inhibitors. In that also MAO inhibitors means there are two types of MAO. Okay. There are two types of MAO inhibitor: irreversible MAO inhibitors and reversible MAO inhibitors. In case of irreversible MAO inhibitors, you have two subtypes: hydrazine derivative, for example, like isocarboxazide, iproniazide, and phenelzine. These are the hydrazine derivative which are reversible inhibitor of MAO, irreversible inhibitor of MAO. So they will inhibit irreversibly monoamine oxidase. Now non-hydrazine derivative like tranylcypromine. Tranylcypromine is a non-hydrazine derivative which is a reversible inhibitor of MAO. Irreversible inhibitor of MAO. These are the irreversible inhibitor of MAO. Or reversible inhibitor of MAO. RIMA means क्या? Reversible inhibitor of MAO. Okay. So in that case you have meclobamide. Meclobamide, that is a reversible inhibitor of MAO. इसके ऊपर भी क्वेश्चन आ चुका है, वन ऑफ द फॉलोइंग ड्रग इज अ रिवर्सिबल इनहिबिटर ऑफ MAO, ऐसा क्वेश्चन आ चुका है। तो आप में ऑप्शन में ये सब एग्जांपल्स होंगे। तो रिवर्सिबल कौन सा है, इरिवर्सिबल कौन सा है? रिवर्सिबल में देखो मेक्लोबेमाइड, ओके, एंड इरिवर्सिबल में कार्बोक्साजाइड, नार्जिन एंड ट्राइनिल्सिप्रोमाइड। इन केस ऑफ MAO irreversible MAO inhibitor, so you have to follow strict डाइट। तो माओ इनहिबिटर्स आपको इसके साथ में नहीं लेना, जैसे मिल्क, चीज, मिल्क प्रोडक्ट, चीज, ग्रेप फ्रूट जूस वगैरह। तो इसमें एक these kind of stuff or cheese, milk, butter, etc. These wines, particularly alcohol wines, etc. So in that stuff, there is a presence of one amine known as a tyramine. You take that tyramine, and if you take MAO inhibitors together, so MAO inhibitors will inhibit the monoamine oxidase, and tyramine is also monoamine, so it will not be oxidized, and tyramine is a precursor for your noradrenaline. There will be hypertension, so that's why MAO inhibitors and MAO inhibitors on this cheese or wines and milk stuff are not taken together. There is a development of cheese reaction. We'll see it again later. Then second class will be a non-selective MAO inhibitors, non-selective monoamine reuptake inhibitor. So they are the reuptake inhibitor, non-selective monoamine reuptake inhibitor. Is they will prevent the reuptake of your noradrenaline, dopamine, serotonin, etc. So non-selective means ये सबका अपटेक इनहिबिट कर देंगे। सो उसमें क्या आता है, उसमें फर्स्ट क्लास है ट्राइसाइक्लिक एंटीडिप्रेसेंट। सो उसका मैकेनिज्म क्या है, they are a non-selective MAO monoamine reuptake inhibitor. So in that tricyclic antidepressant, imipramine, desipramine, amitriptyline, nortriptyline, doxepin, atoxepin, then clomipramine. Okay, clomipramine, imipramine, clomipramine, desipramine, amitriptyline, nortriptyline, doxepin, natoxepin. Okay, miscellaneous में आता है azone and venlafaxine. These are the two classes. First one is a monoamino oxidase inhibitor. In that also you are reversible. And second class non-selective monoamine reuptake inhibitors. So in that you are tricyclic antidepressants and miscellaneous. Now third class is nothing but the selective serotonin reuptake inhibitors. So we have seen that fluoxetine, paroxetine, fluoxamine, sertraline, citalopram, etc., etc. Now fourth class selective noradrenaline रीएप्टेक इनहिबिटर। इसके ऊपर भी क्वेश्चन आता है कि वन ऑफ द फॉलोइंग इज ऑन सिलेक्टिव नॉर एड्रेनालिन रीएप्टेक इनहिबिटर। तो इसमें ये देखो रोबोक्सिटिन जो है दैट इज द एक्सेप्शन। सो ऑल द जेटिन्स, जो जेटिन्स होते हैं दे आर नोन एज सिलेक्टिव सेरोटोनिन रीएप्टेक इनहिबिटर, बट दिस रोबोक्सिटिन इज द एक्सेप्शन. Roboxetin is a selective noradrenaline reuptake inhibitor. Then maprodilene is also there. Mood stabilizers में क्या आएगा? लिथियम कार्बोनेट. Miscellaneous compound में आएगा carbamazepine. Again see the classification given by KD Tripathi. This is a classification in KD Tripathi. Classification 2-3 बार ले रहा हूँ मैं because that is important. Classification is important. इसके ऊपर questions maximum बनते हैं. That's why we are taking 2-3 times. Okay. Now again, classification of antidepressant drug. We'll take this classification. First one is a reversible inhibitor of MAO. MAO inhibitors में आता है reversible. So RIMA, reversible inhibitors to MAO A. MAO में भी दो टाइप आता है, MAO A, MAO B. We'll see in upcoming slide. So reversible inhibitor of MAO A, meclobamide and chlorogylin. Okay, meclobamide, chlorogylin. And second class is a tricyclic antidepressant. So in that you have two subclasses. So noradrenaline and 5-hydroxytryptamine is noradrenaline and serotonin reuptake inhibitors. इसमें आता है आपका imipramine, amitriptyline, imipramine, doxepin, dothepin and clomipramine. These are the reuptake inhibitor for serotonin as well as noradrenaline. Then in tricyclic itself you have another class, predominantly reuptake inhibitors, predominantly noradrenaline reuptake inhibitor. मतलब ये जो ड्रग्स है ये नॉरएड्रेनालिन प्लस डोपामाइन, सॉरी नॉरएड्रेनालिन प्लस सेरोटोनिन, ये दोनों का reuptake इनहिबिट करेंगे, इनका लेवल बढ़ा देंगे बिकॉज डिप्रेशन में लेवल कम हो चुका है, बढ़ा देंगे. predominantly noradrenaline reuptake inhibitor. तो ये जो ड्रग है these will predominantly or selectively increase the noradrenaline level like desipramine, nortriptyline, amoxicillin and roboxetine. Third class will be your selective serotonin reuptake inhibitor. So all the zetins, fluoxetine, oxetine, atomoxetine, dopaxetine, sertraline, citalopram जो है वो, और ये इसिटलोप्राम जो है वो, तो इसका ई आइसोमर है ये sertraline. These are also selective serotonin reuptake inhibitor. Now next class is serotonin and noradrenaline reuptake inhibitor. ड्रग है जो noradrenaline का reuptake inhibitor करते हैं selectively. कुछ ड्रग है जो noradrenaline प्लस serotonin का करते हैं, ठीक है. कुछ ड्रग जो है सिर्फ सेरोटोनिन का करेंगे, कुछ ड्रग जो है वो हिस्टामाइन 5-hydroxytryptamine दैट इज उसका भी करेंगे. सेरोटोनिन एंड नॉरएड्रेनालिन रीअपटेक इनहिबिटर कौन है? वेनलाफैक्सिन एंड ड्यूलोक्सिटिन. टिपिकल एंटीसाइकोटिक ड्रग्स, एटिपिकल एंटीडिप्रेसेंट्स, तो उसमें क्या आता है? ट्राइजोडोन, मेट्राजेपिन, विप्रोपियोन, टाइनेप्टिन, अमाइनेप्टिन एंड एटोमोक्सिटिन. ये है एटिपिकल. I will save the recording ones and then we'll continue. आपको हॅलो समजतंय का? समजत नसेल तर सांगा मला, काही नाही कळालं तर ते तेवढं रिवाइज करूया.